This distance learning exercise is titled An Introduction to the Clinician's Role in the Laboratory Detection of Emerging Infections. As a health professional, you are the first line of defense in identifying an infectious disease outbreak. Working in collaboration with the professionals in the State Public Health Laboratory and Sentinel Laboratories, known collectively as the Laboratory Response Network, or LRN, you can promptly identify infectious disease outbreaks, enabling a rapid response that can save lives. This program has been jointly developed by the CDC-funded New Jersey Center for Public Health Preparedness at the University of Medicine and Dentistry of New Jersey School of Public Health and the Division of Public Health and Environmental Laboratories of the New Jersey Department of Health and Senior Services through the Bioterrorism Preparedness and Planning Cooperative Agreement with the CDC. This is an interactive presentation. To move forward or backward, click on the appropriate arrows which appear on each page. Additional hyperlinks will sometimes appear. Clicking on these will open your web browser to link to a web page for more information. Your computer will need to be online to complete these connections. On completion of this program, you will be able to identify resources for sample collection of agents of bioterrorism and other emerging infections. Describe your responsibilities for shipping biological and infectious substances. Describe the capabilities of the New Jersey Laboratory Response Network, known as the LRN. Describe how public health information may aid in early and accurate diagnosis and clinical practice. The target audience for this presentation consists of nurse practitioners, physician assistants, and several physician specialties, including but not limited to primary care physicians, internists, dermatologists, and pediatricians who practice in the community or in a hospital. Any incident, deliberate or inadvertent, that has the potential to cause harm can affect both people and places. An explosion and most chemical attacks are immediately obvious with a clear point of origin and pattern of damage. A bioterrorist attack isn't always immediately obvious. The Laboratory Response Network identified anthrax as the biologic agent in the attacks of 2001 from clinical samples. These cases presented before the extent of the environmental contamination of postal facilities was known. Bioterrorist attack hurts people and may contaminate buildings. The clinicians who identify the victims are the first responders. Clinical specimens may be the only means to confirm a suspected attack. The identity of the causative agent may be the only way to know whether an attack has occurred at all. The astute clinician is a critical component of this pathway. Since chemical and biologic agents can cause similar symptoms, it is important to order the appropriate laboratory tests that can rule in or rule out either situation. If the laboratory diagnosis confirms the disease with public health significance, then the public health agencies initiate the response. The public health findings are shared with the clinicians to guide the treatment and management of the affected. Dr. George DeFerdinando was the acting commissioner of the New Jersey Department of Health and Senior Services during the anthrax attack of the fall of 2001.
We first learned about the possibility of anthrax in New Jersey when cases of skin anthrax occurred in New York City. These were well documented. They occurred in the news media there. Many of the people in that part of New York City live in New Jersey and commute to the city. So we set up a call center at an emergency around-the-clock call center, help center for people, under the idea that people would need some questions answered on whether they had been exposed, whether they needed to be treated, things of that matter. Very rapidly, very soon after we set that up, we received 2 phone calls from physicians in New Jersey, dermatologists who were taking care of 2 different postal workers, both of whom had dermatologic abnormalities that, on reflection, were consistent with two primary care physicians who were taking care of these postal workers saw the news and chose to pick up the telephone and call the hotline, which is the ultimate type of surveillance, a well-educated healthcare professional who's ready to act. That's the ultimate surveillance. There are other types of passive surveillance or even active surveillance, but that type of surveillance, knowledgeable people who are aware to, if they see something, to call, that's a very important object. We are needed to collect samples at the Hamilton Postal Facility. The New Jersey Department of Health and Senior Services lab, under the direction of the state epidemiologist, Dr. Eddie Bresnitz, collected samples throughout that building in conjunction with the Federal Bureau of Investigation and the postal inspectors. And those samples were used to document the extent of the contamination in that building. At the same time, requests for testing of samples from throughout New Jersey started flooding into our lab, all manner of objects, literally the kitchen sink, as well as other materials to be tested. And we did have to make some decisions, prioritizations on what was a reasonable sample, what was a sample that might have been exposed. These are decisions that had to be made very quickly and under a lot of pressure, and our lab had to perform.
Following case study illustrates how a patient with an unusual infection might present to a clinician. Here is his history.
Hey Doc, how you doing? I got this strange looking thing in my right arm I was hoping you could help me out with. Started out as this itchy red kind of a patch that got worse. It became a blister, and then the blister turned black. No medical history, just the type 2 diabetes that you've been treating me for. That's been under control. I've been doing great with that. No, I never hit it. Out of the country? No. Foreign visitors? No, I haven't seen any foreign visitors. No, I just worked down at the IRS regional office as a file clerk.
Physical examination of the patient is normal, except for a low-grade fever and the 2-centimeter non-tender necrotic ulceration with local edema on the right forearm. Upon palpation, the right axillary lymph nodes are found to be enlarged. In an encounter with a patient, you should ask the following questions. Is there something unusual about this case? Could it be an infection caused by an agent of bioterrorism? Why and to whom should I report my suspicions? What specimens would help make the diagnosis or be helpful in a public health investigation? Where and how should the specimen be sent? You may think in terms of this algorithm: suspect, report, collect, transport, or refer a specimen to the laboratory. After taking a history and examining the patient, consider the possibility of a disease caused by an emerging pathogen. This suspicion may be strengthened by the patient's work or travel history or contact with individuals from outside the country. The patient's physical examination may reveal dermatologic lesions or other findings pathognomonic for diseases of public health significance. In case number 1, several diseases come to mind, including gangrene, infected insect bite, staph or strep infection, or cutaneous anthrax. The circumstances about case number 1 are unusual enough to alert you to report your suspicion to the New Jersey Communicable Disease Service and the local health officer. Case definitions for agents of bioterrorism are included on the New Jersey Department of Health and Senior Services Communicable Disease website. The New Jersey Communicable Disease Service can be reached at these numbers. Additional information about reporting diseases can be found in the main directory of this CD or by clicking on the links on the slide if you are online. The directory of local health officers can be found online at the link on your screen. The materials found on this CD are current as of June 2006. When reporting to the New Jersey Communicable Disease Service, you should be prepared to give the medical history and physical findings of the case, as well as any available laboratory results. The demographic information about the patient should be disclosed. New Jersey law and regulations mandate reporting of confirmed or suspected diseases of public health significance. Reporting for public health purposes is specifically exempted from the HIPAA regulations. You do not need the patient's permission before making a report. Epidemiologists at the New Jersey Communicable Disease Service will be able to provide guidance as to what specimens should be collected for laboratory examination. It is possible that you will be advised to have the sample analyzed at the local clinical microbiology laboratory first. In this case, contact them for specific guidance on sample collection and handling.
Well, the LRN, in its sentinel capacity with the clinical microbiology labs, forms a traditional function by providing clinical data in a rapid and accurate fashion so that the physician can make a timely and accurate diagnosis. The LRN also helps to provide data for a rapid public health response in an outbreak situation and surveys the community for organisms of interest that could lead to an outbreak. Well, if you suspect that a patient may be infected with an agent of bioterrorism, you're required by New Jersey law to contact your local health department immediately. And if samples need to be taken from that patient and routed to the LRN, either at the sentinel level or at the state level, you also need to contact the Communicable Disease Service at the 609-588-7500 number for advice on routing those samples. And there's a long list of organisms and diseases which you should be aware of that you need to report. Well, I can't say this too strongly. The quality of the sample determines the quality of the results produced by the laboratory. If we don't receive a sample that is collected in the right amount, the right volume, if the transport is delayed for some reason, or if the sample is collected from the wrong site or at the wrong time, we could miss the result altogether. So the primary care practitioner and physician are critical to the laboratorian in sample collection for production of an accurate result.
Effective laboratory identification of a microorganism requires appropriate selection, collection, and handling of a specimen. General guidelines of the American Society for Microbiology include: avoid contamination from indigenous flora whenever possible to ensure a sample representative of the infectious process. Select the correct anatomic site from which to obtain the specimen. Collect the specimen using the proper technique and with the proper tools. If the suspected organism is anaerobic, biopsy or needle aspirates are the specimens of choice. Never refrigerate specimens submitted for anaerobic culture. Maintain them at room temperature. Collect adequate volumes of the specimen. Place the specimen in a container designed to promote the survival of the suspected agents. Use containers that do not leak. Follow this link for more information about the appropriate specimen collection for the detection of specific agents of bioterrorism. Label each specimen container with the patient's name and identification number, the source or site of the specimen, the date and time of the specimen collection, the initials or other identification of the collector. Your laboratory may have additional requirements. Transportation to the laboratory. Ideally, specimens should be transported to the laboratory within 2 hours of collection. You and your staff need to be familiar with the hazardous materials regulations for the proper packaging and transportation of biological and infectious substances and other dangerous goods or hazardous materials that you may encounter in your practice. The international term dangerous goods means the same as the term hazardous materials used here in the United States. If you fail to comply with these regulations, you could be subject to substantial monetary penalties and, under certain circumstances, criminal prosecution. Biological and infectious substances are regulated for transport by air, ground, and water by 3 agencies: the United States Department of Transportation, DOT, the United States Postal Service, USPS, and the International Air Transport Association, IATA. There are several types of hazardous materials that you may handle in your practice. The most common are patient specimens, infectious substances, and formalin. Most of the patient samples that you handle will be exempted from the rules. DOT, USPS, and IATA exempt samples with a minimum likelihood that a pathogen is present. Examples of exceptions might include blood for cholesterol testing, specimens for insurance screening, glucose testing, and prostate-specific antigen. This table illustrates several common scenarios and the packaging regulations that apply to non-exempt samples. By classifying what type of sample you are shipping, biological or infectious, and who is transporting your sample, a hospital courier, the Postal Service, or FedEx, you can determine the appropriate regulator and packaging instruction. As a hazardous materials employer, you are responsible for the function-specific initial training and periodic retraining of staff on a schedule designated by the regulators. The training should include information about packaging instructions and requirements based on the mode of transport. The employer must assure that United Nations or UN certified packaging with a Class 6.2 designation is used when shipping infectious substances. Other types of packaging are needed for biologic substances. The employer must retain documentation of the shipment based on the regulator's schedule. Your employee, as a hazmat shipper, has the responsibility to classify the sample as a biologic, infectious, or exempt substance prior to packaging and transporting, to identify the sample using the internationally recognized terms and the correct UN number assigned to the substance, to mark, label, and package the sample according to the appropriate regulations for air, ground, or water transport, to document each shipment and retain a copy, to notify the intended receiver when the sample leaves your facility and the anticipated time of its arrival. Each of these steps is critical to the successful and safe transport of hazardous materials. For a patient sample classified as a biologic substance, this slide shows an example of the packaging materials that should be used. Some carriers are exempt from the biologic substance packaging requirement because they use vehicles dedicated to this purpose. Check with your carrier to determine if this exemption applies. However, there are no exceptions for packaging infectious substances. This slide shows an example of the required markings and labels on a package containing a biologic substance transported by ground. Ground transportation is regulated by the United States Department of Transportation. For a patient sample classified as an infectious substance, this slide shows an example of the packaging materials that should be used. In this slide, pictures 1 through 5 illustrate the steps involved to properly package an infectious substance for transport. The first picture shows the primary receptacle containing the sample. The second shows that sufficient absorbent material is placed inside the secondary packaging. The third picture shows that the primary receptacle may be wrapped in cushioning material, such as bubble wrap, to prevent breakage or shifting during transport. Next, the secondary packaging is closed and secured inside the outer packaging. Next, an itemized list of package contents is placed between the secondary packaging and the outer packaging. Finally, the outer package is sealed and the appropriate markings and labels are affixed. Depending on the method and mode of transport, appropriate shipment papers must be completed and attached to the shipment. This slide shows an example of the required markings and labels on a package containing an infectious substance transported by ground. More information and appropriate markings and labels are necessary for infectious substances than are required for a biologic substance or exempt sample. There are times when hazardous materials are carried in a healthcare worker's private vehicle. This means of transport is called materials of trade, or MOTS, and requires the use of combination packaging. The inner package must be leak-tight for liquids. The outer package must be strong with tight packaging. It must be securely closed, and in the vehicle it must be secured against movement. The vehicle operator must be aware that he or she is carrying hazardous materials. This slide contains links to the 3 hazardous materials or dangerous goods regulators. This slide references specific regulations for training requirements for each of the 3 regulators. This material is also available in the reference directory on this CD. If specimens are expected to have legal or criminal significance, as in the case of suspected bioterrorism, then it is important to maintain a chain of custody. Chain of custody means knowing where the specimen is and who possesses it at all times. If samples are to be sent to the state public health laboratory, the chain of custody information is included on the request form. For additional information about chain of custody, please see the reference directory. Now let's discuss the identification of emerging infections from the clinical laboratory's perspective. Clinical laboratories have 2 roles in a bioterrorism event or other public health emergency. First, to determine the diagnosis, and second, to facilitate epidemiological response by alerting public health authorities. Clinical microbiology laboratories in hospitals and commercial sites are the sentinel laboratories in the laboratory response network. They determine the etiology of an outbreak or epidemic. In 2006 in New Jersey, there are 66 sentinel laboratories. This slide illustrates the sequence of events that takes place when the sentinel laboratory identifies an organism of public health significance. After analyzing the specimen, the sentinel laboratory notifies the submitting clinician of the findings so that treatment can be initiated. The Sentinel Laboratory then notifies the state and local health department so that they can initiate an epidemiologic investigation and alert those who need to know in order to stop any further spread of the disease. This alert may be focused or general, depending on the organism and the information known at the time. The alert will be updated as more information becomes available. The health department will contact the physician for additional information. Remember, providing patient information required for public health purposes is not prohibited by HIPAA. In 1999, the CDC established the Laboratory Response Network, or LRN, to rapidly respond to bioterrorism or other public health emergencies. The LRN consists of national, reference, and sentinel laboratories. The national laboratories are responsible for specialized strain characterization, bioforensics, select agent activity, and handling highly infectious biological agents and toxic chemicals. The laboratories are part of the Centers for Disease Control and Prevention and the United States Army Medical Research Institute for Infectious Diseases known as USAMRIID. Reference laboratories are responsible for investigation and/or referral of specimens to national laboratories. There are more than 100 state and local public health, military, federal, and international laboratories of this type. Veterinary, agriculture, food, and water testing laboratories have also been identified to provide specialized testing. The New Jersey Public Health and Environmental Laboratory is the New Jersey LRN Reference Laboratory. National and reference laboratories are found throughout the United States. Sentinel laboratories are the backbone of the LRN. Clinicians are most likely to interact with these laboratories, which provide routine diagnostic services and screen for many agents of public health concern. Though these laboratories may not be equipped to perform the same tests as LRN reference laboratories, they can analyze samples to determine whether they should be referred for further testing. The responsibility for producing diagnostic data rests primarily, but not exclusively, with the Sentinel laboratories, whereas the complementary responsibility for generating epidemiologic information is with the State Public Health and Environmental Laboratory. Vigilant and alert physicians and Sentinel microbiologists are key to the early detection of infection or intoxication from an emerging pathogen or a covert bioterrorism attack. Public health laboratory professionals then carefully characterize the agents detected by their clinical counterparts, so an epidemiologic and/or criminal investigation can ensue. The next case illustrates how physicians, public health investigators, and the Laboratory Response Network work collaboratively in a rapid and coordinated response that will protect individuals and their communities.
Hi, doctor. I'm here because Rebecca's got very bad diarrhea. It came on a few days ago. It's the worst I've ever seen. No other family members have been ill. No, she hasn't been traveling anywhere, and no one that I know has been traveling that's had contact with her. Yeah, she's just been doing her regular activities. She's been going to daycare. She goes every day. They have picnics there. They swim in the swimming pool.
On physical examination, the child is afebrile but exhibits generalized abdominal tenderness. The pediatrician takes a rectal swab, which tests positive for blood. A stool specimen is requested. Later that day, this specimen is sent to the local commercial lab for Shiga toxin and culture. The pediatrician's differential diagnosis includes E. coli infection, salmonellosis, shigellosis, viral gastrointestinal illness. Sentinel Laboratory reports the positive Shiga toxin later that day. Based on this finding and the fact that the patient attends a daycare center, the physician notifies the local and state health departments. 48 hours later, the Sentinel Lab cultures E. coli 0157. The Sentinel Lab sends the microorganism to the reference laboratory. These findings set in motion a number of actions. The laboratory informs the pediatrician of the findings, and appropriate treatment is begun. The Sentinel Laboratory informs the local health department of the child's residence through a secure web-based reporting system. An epidemiologic investigation is begun with stool specimens collected from children at the daycare center. These specimens are sent to the state lab for screening. If positive for E. coli 0157H7, they will be subtyped. If the subtypes match that of the index case, the outbreak will be considered to have originated from a common source. The local health department will institute infection control procedures at the daycare center. The Communicable Disease Program will initiate active surveillance to identify other cases. When we review the clinical response algorithm for this case, we find that bloody diarrhea in a child makes you suspect a potential serious disease, such as that caused by E. coli 0157H7, with possible public health implications. You should report your suspicions to the public health officials because transmission of the disease by E. coli or other enteric pathogen is usually through contaminated food or water. Stool samples need to be collected. The samples need to be transported as a biologic substance to the lab to be cultured and tested for Shiga toxin. Subtyping will be needed to confirm the diagnosis of this case. The third case study represents a surge event. This happens when the state experiences a major public health incident, such as a bioterrorism attack. In this scenario, Yersinia pestis, the plague bacillus, has been released in a PATH train leaving New York City. Several days later, patients with severe respiratory symptoms present to local emergency departments and physician offices. The symptoms and rapid laboratory testing rule out influenza A. The sputa contain a gram-negative rod, and when analyzed at the Public Health Laboratory by LRN rapid methods, the results are positive for Y. pestis. The governor declares a public health emergency based on this LRN data and epidemiologic picture as authorized by the recently enacted New Jersey Emergency Health Powers Act. The Commissioner of Health and Senior Services is empowered to exercise broad authority to control the disease outbreak, including commandeering health care and other facilities, overriding hospital credentialing, and mandating the use of universal respiratory precautions in all clinical settings. The laboratory identification of isolates by the LRN becomes exceedingly important to help track the extent of the outbreak, investigate its source, and aid in the clinical care of patients. Because this Emergency Health Powers Act may impact upon your practice in an emergency situation, it is important that you are aware of it. During the outbreak, an 18-year-old Rutgers freshman reports to the University Health Center with chief complaints of fever, chills, cough, and headache. He says he has been feeling ill for about 24 hours. He recalls that he had been in contact with a friend who within the past week was diagnosed with pneumonic plague. The young man's physical examination, sputum gram stain, and chest X-ray are consistent with a diagnosis of gram-negative pneumonia. The history, physical examination, laboratory, and X-ray findings make this case suspect and should be reported to the health department immediately. As the epidemic progresses, the Communicable Disease Service will decide if a sputum specimen should be collected. This decision will be based on the characteristics and course of the epidemic and the need for additional laboratory information. If there is already a clear picture of the epidemic, the specimen may be needed for clinical purposes only. If the state health department elects to have the specimen sent to the reference laboratory, the specimen should be transported as an infectious substance. The Laboratory Response Network in New Jersey appreciates your attention to the information presented in this learning exercise. You are a vital part of a public health system with linkages to the state's laboratories and health departments. The active participation of vigilant clinicians assures a rapid public health response to protect our communities from the spread of infectious diseases. As a healthcare provider in New Jersey, we urge you to join the local Information Network Communication System, known as LINKS, and the Health Alert Network. You can obtain more information about these communication networks and register at the NJ LINKS website on the screen. If you would like to learn more about the New Jersey Medical Reserve Corps and volunteer for this program, click on this link. If you would like to test your knowledge of the information provided in this exercise, click onto this link. For more information about any of the materials in this presentation or the Laboratory Response Network, please contact either Susan McCorsky or Rudolph Chesko at the New Jersey Department of Health and Senior Services at one of these numbers.